In the R&D team, one of the special systems that we have created in-house is called the Artificial Ear Environment, short for AEE. This system is very special, and the reason why it is because every new device that we created, we would put into this system. The system actually simulates a lot of what's happening in the actual human ear.
The Lyric 2 insertion tool is quite a bit different than the insertion tool used for Lyric 1. And the reason why we had to change to a new insertion tool was Lyric 1 has a joint in the device, and so as the device is pushed into the ear canal with the insertion tool, it can migrate around bends. Whereas Lyric 2 is a shorter device with no joint. So what we did is we took the joint out of the Lyric 1 device and put it into the insertion tool for Lyric 2.
So the manufacturing process for Lyric 2 is unique. It's different from the way other hearing aids are manufactured, and a lot of the process development and tooling and fixture development to make the product were developed right here in Newark, California.
Familiarize yourself with the live screen and its options for calibration, start-stop, mute-unmute, volume control, back, and home. You can choose between symbol or graphical Doppler display and internal or external ECG screens. You are now ready to start a procedure. Use the ECG electrodes from the Stylet Bedside Procedure Kit or preloaded Aero Catheter Kit. Attach them to the ECG leads. Place the electrodes on the patient's body per the VPS Stylet instructions for use.
About 10 years ago, I did 3 rounds of the oral treatment. And I was nervous about that because you did have to have a blood test and worry about an adverse effect on your liver. But I was desperate to try to correct the problem, so I went through it 3 times. It was quite expensive, and I had no success with it.
Many people turn to their doctor convinced they will have to live with ugly nails for the rest of their lives. If you have toenail fungus or are embarrassed by your nails, there is a new solution. Genesis Plus Laser Therapy. Genesis Plus is a fast treatment that takes your doctor approximately 20 minutes to perform. The treatment is very tolerable, requires no anesthesia or numbing medicine, and there is no downtime following the procedure.
Miradry is a non-invasive outpatient procedure performed in a dermatologist's office. No surgical incisions or cuts are involved. The Miradry system delivers precisely controlled electromagnetic energy to the underarm area where the sweat glands reside. The sweat glands are then eliminated. This does not affect the body's ability to cool itself.
From the versatile OptMe Pico to the technologically sophisticated OptMe Prergo or the conveniently portable iMag loops, you will find that the optical brilliance offered by all virtually defies comparison. Through our partnership with Spear Education and the Scottsdale Center for Dentistry, Carl Zeiss is proud to provide optical instruments that augment the clinical education experience. Today, you will have the opportunity to use the Zeiss OptMe Pico Dental Microscope. Before you get started, we'd like to take a few minutes to demonstrate how to use the OptMe Pico microscope. Positioning the microscope and adjusting the light. Establish a comfortable ergonomic operating position. Raise or lower the microscope so that you remain upright while looking straight into the optics. The eyepieces can also be adjusted into the operator's line of sight by tilting them up and down.
The nurse turns on the controller. The cartridge is removed from its sealed pouch. The nurse's access card is scanned to confirm authorized use. The Release tab is removed from the cartridge. The cartridge is then inserted into the dispenser. The dispenser is attached to the controller. Next, remove the dispenser cap. The nurse primes the system by ejecting the priming cap into her hand. The dispenser is now locked into the controller, preventing access to the drug cartridge. The unique patient thumb tag is scanned to match the patient to the controller. Women diagnosed with early-stage breast cancer are typically treated with breast-conserving surgery, known as a lumpectomy, as opposed to the more radical full breast removal or mastectomy. Intraoperative radiotherapy using the intrabeam system differs from traditional external post-surgical radiation treatment systems by radiating the tumor bed from within, ensuring targeted treatment delivery.